Garissa County, also home to the unique and endangered Hirola antelope, is one of Kenya's fastest growing counties and a gateway to the arid northern region. One of Kenya's Vision 2030 strategies for the health sector is to provide equitable and affordable healthcare at the highest affordable standards for her citizens. In line with this vision, it is indeed commendable that within a short span following the promulgation of devolution, Garissa has made tremendous strides in the healthcare sector and has recently been rated the overall best performing county in terms of healthcare delivery services. This indeed is a remarkable achievement for a county which only a few years ago was among the most marginalized in the country. In all parts of the county, from Balambala to Hulugo, Liboi to Masalani, Modogashe, Ijara, Dadaab, Fafi, Lagdera, and Garissa Township, among others. The improvements in healthcare are clearly evident, with the residents of the county joyfully appreciating the leadership of Governor Najah Jama, who has taken a personal commitment upon himself to enhance this sector specifically. It all started when a comprehensive, result-oriented strategic plan was formulated by the county government for the healthcare sector, with a vision for a healthy and productive county. The plan envisaged great achievements for the sector within a short period of 5 years from 2013 to 2018.
When we started the county government of Garissa in 2013, one of the first things that we did was to come up with a very robust strategic plan for the department for the years 2013-2018. And that, of course, covered a lot of things. It covered really, a journey that we were to take to change the face of healthcare in Garissa County for the next 5 years. That was 2013-2018. And we started that journey, and that journey indeed was a journey that was full of challenges, but also a lot of opportunities at the same time. And we took upon ourselves to ensure that we covered every aspect of the sector, particularly with regard to reaching out to the farthest corners of the county.
And that reaching out has indeed occurred. Within the first 2 years of the existence of the county government, infrastructure developments were undertaken for the sector at levels not witnessed any time before. For instance, history was made on 27th September 2016 when the first ever cesarean section operation was performed in Balambala Sub-County Hospital. A clear confirmation of the county's commitment in expanding surgical interventions by constructing and fully equipping state-of-the-art theaters in all the main towns of the county. This meritable achievement has increased the number of operating theaters from 3 to 6.
For the first time, for the last 50 years, it's for the first time that our sub-county hospitals are actually carrying out operations like cesarean section and other operations. Our theaters in the sub-counties are now functional, and the doctors are carrying out operations in the sub-counties. And it's important to know that our Garissa County Referral Hospital is actually serving many counties. It is serving so many counties in the eastern part, both upper and lower eastern part, and then we are serving the coast. We are serving Mandera County, and as far as even some parts of coast are coming to our county referral hospitals for specialized services and operations.
Garissa only had 10 ideal maternities before devolution. However, with the inception of the devolved governments, an additional 25 new, fully equipped maternity hospitals have been dispersed across the county, thus increasing the uptake of skilled deliveries. For instance, in 2011, the county only recorded 7,136 skilled deliveries compared to 10,633 in 2015, only 2 years after devolution, a 28% to 45% increase.
I can confidently say we have a healthier population in Garissa County, especially that of our mothers and children, because we have increased the number of women who are delivered by a skilled attendant from 28% before devolution to 42% currently. We have also increased the immunization of our children from 48% to 60% currently.
Bibi yangu hii ambeleni anakufa matoto 7. Watu walimwambia mimi iko Garissa kitu kutosha tertari na mtoto saidiana huko kitoko huko mimi kukuja kwa ambulance. Serikali ndio nalete sisi napata raha, tunapata mtoto tunashukuru sasa. Sisi hiyo tu. Tanini taliombia nyinyi watu wa Garissa yote tertari na wananchi kana wanawake wanafanya kazi yote. Mimi nashuhudia shukrani.
The county has 2 functional maternal shelters, one in Garissa County Referral Hospital and the other at Masalani Sub-County Hospital. Garissa County, the pioneer of maternal shelters in Kenya, provides free accommodation, free food, and other essentials to expectant mothers, their husbands, or relatives, which has improved maternal and newborn health of its residents.
Governor Jama, today I have witnessed today the efforts and investments you have made towards improving the healthcare service and delivery for the people of Garissa County. Increased health infrastructure, dispensaries and maternity wards, establishment of new community healthcare units, recruitment of healthcare workers, purchasing of motorbikes to support community outreach services are among the many activities that you're undertaking. I'm especially impressed by the maternal shelter that ensures that mothers who come from hard-to-reach areas are able to stay, bringing their pregnancies to term and to deliver their babies safely. This all speaks volumes of your desire for a healthy society, and I am here today to join you in making that desire a reality.
Similarly, before devolution, Garissa County only had 42 dispensaries. Under the new devolved government, Garissa has constructed and operationalized 16 modern dispensaries, thus increasing the number of dispensaries to 58. This has improved accessibility and reduced the distance of seeking healthcare services in the remotest parts of the county.
We have seen in places that far to reach area that had no dispensaries and no maternities. Now there's dispensaries in place, the maternities in place, and of course we have operationalized around 2 of the dispensaries that has been completed by the county government. One is Boger dispensary, and the other one is Banana Scorecard dispensary that is currently operational. And that is with the blessing of the county government, because it has really, these are areas that we used to go for outreach, but now service has been taken to the community and the nurses has been posted there.
In order to bring radiology services closer to the population, Garissa County has expanded these services by constructing and equipping X-ray centers in various major hospitals in the county.
My name is Mohammed Abdurrahman, Health Administrative Officer, Ijara Sub-County Hospital. This is an X-ray unit which was constructed by the county government in the last financial year, and which was officially launched also by His Excellency the Governor on 23rd March 2015. These services are mostly requested by patients from all over, even along the peripheries, because this is a sub-county referral hospital where patients come in large numbers. So this service is very important, and we appreciate the county government for initiating such construction.
Also, Garissa County Government has improved the quality and accessibility of Garissa County Referral Hospital in bid to provide complex clinical care to patients referred from lower levels.
Prior to devolution, this hospital had lagged behind in so many services. First of all, even the specialists that were here were not enough. So now we have a lot of specialists. We have consultants ranging from general surgery to ophthalmology to medicine and pediatrics. And so, it's been a milestone because we haven't had those consultants before, and now they exist. The infrastructure has improved. Human resources has also improved.
Before the inception of devolution, there was no proper functional referral system. As a result, many patients were lost, and it was the responsibility of the patients to cater for their referral expenses.
Zamani tukitoka huko hata mwanamke anakufia kwa barabara, tuliwahi kubeba mwanamke na kereta akakufia kwa barabara kwa sababu hakuna nini. Sasa hii ambulance zinatusaidia, mtu akikuwa mgonjwa na kuja simu ndio ambulance inasaidika.
Previously, people used to pay for referral services. They used to fuel for ambulances to be for their patients to be transferred from our facility to other facility. But with the county government, patients are able to access referral services free of charge anywhere in the country. This has really improved, and also it has been helped with the acquiring of Red Cross ambulances, which have really improved our referral services. And also, the county government has ensured that in each sub-county in the county has at least 2 ambulances which are standby. This one has really improved on our services, referral services, and have remarkably decreased mortalities due to delays in referral services.
In dealing with these critical gaps and facilitate linkage, the county established a command and control center situated in Garissa County Referral Hospital to ensure swift provision of a 24-hour referral services in all the remote parts of the county.
Initially, we used to have, before devolution, Garissa County is an autonomous devolved county, and before devolution we used to have referral systems in place, but there was a lot of challenges, and like we used to have, for example, an ambulance, but those are actually not a real ambulance. When you talk about ambulance, you have to have a well-equipped ambulance that is a life-saving. Yeah, and like everything that pertains to patient's life and care needs to be in that ambulance. But what we used to have is like we used to have an ambulance maybe without an oxygen. We used to have an ambulance but without supplies. We used to have an ambulance without maybe even a paramedic. Yeah, and so like it used to work, but not the efficiency and the quick service delivery that is actually required.
At the advent of devolution, Garissa County Department of Health inherited 382 staff from the national government. In dealing with the medical staff shortage in the county, the department went further and recruited 645 staff since devolution, thus making a total of 1,027 health workforce. Also, 160 casual staffs were contracted by the county government to offer supportive function to the department in various health facilities across the county.
For instance, just last month, I received 2 new nurses. I deployed them in one of the facilities within the sub-county. So that is a plus for us. And we are seeing this as a blessing, regardless of the area where we are in. You know, we are in the farthest corner of the county. It's, in fact, just inside Boni Forest, an area that has been in the news for all the wrong reasons. So we are hoping that with this effort that the county government is putting in, and our department is still emphasizing that we continue to persevere and serve the community as best as we can.
The retaining of health workers in remote areas is not an easy task. To curb this challenge, the county government of Garissa has built modern houses for health workers in all the 7 sub-county hospitals. The Department of Health also trained and promoted over 300 seconded staff who had stagnated for more than 10 years.
I'm happy to tell you that we have promoted all the county health devolved work, our health workers, and we are at peace with our workers, and they are motivated and they are happily working with us, and we are happily working with us. We are actually having a team spirit and we're working as a team.
Before devolution, the county only had 32 community health units. Currently, there are 87 community health units, all of them functional and contributing to the success of the county health service provision. Nearly all health facilities in the county are linked to a community health unit.
I'm called Mohammed Bashir. I am a resident of Kotile, but we have an additional work here. Our role as CHWs is to make a link and a connection between the health facility and the community. That's our main work first. And our mission is to improve the condition and the health standard of Kotile. And exactly, we have gone a very far step up to now, and since we have started that job.
Furthermore, the county, under the leadership of Governor Nathif Jama, recently flagged off a group of 60 children with congenital heart disease to receive specialized medical care from a team of US doctors. This will go a long way in putting a smile on the children's faces.
We are happy that we are able today to send off about 60 of our children for that treatment by those doctors from the USA. I'm aware that this is not the first time that this is happening. It has happened before, and a similar number of children have been treated in the past as well. And of course, we are happy that this is again another round of collaboration with that team from the USA. Obviously, as a county government, also we had to play our role in terms of sending off the family, the patients, the kids and their parents. We're doing that today here, flagging off 2 buses of the patients and their parents so that they can safely be tripped to that part where the town where they're going to.
Garissa County Department of Health, in partnership with the World Health Organization, is embracing technology as a way of enhancing service delivery in the health sector. So far, the county has implemented IT system in over 20 healthcare centers, which includes the training of over 100 health workers on the system usage. This admirable and comprehensive electronic health management system, which is real-time, will go a long way to make patient records available instantly and securely to authorized healthcare personnel.
I can only say this is the real fruits of devolution, because if there was no devolution, this would never have happened. Obviously, I want to thank WHO and also the county government team, which has collaborated with the WHO to bring about this very, very innovative system into practice or into use at our dispensaries and at all our facilities. I've been told what this is all about: a fully networked IT system for the entire county facilities, and I would really want to appreciate and thank the doctors, the team that worked with WHO.
These tireless and admirable efforts of the county government in innovating new ways to tackle challenges affecting the health sector in Garissa County are a clear justification for the many awards the county has received. Recently, the Garissa County Referral Hospital Laboratory was awarded the most improved laboratory in sub-Saharan African countries. The same hospital also received awards for Personal Development Plan, Future Leader Rising Star, and Learning Journal. Plus, Garissa County Nursing Department won an award as second best county for mobilization and best innovation practices.
That, of course, has culminated in a lot of good things, a lot of awards, a lot of accolades, a lot of achievements. But more important, that has culminated in us recently being awarded or being recognized as the county with the best score in terms of healthcare delivery services. That has not come by any, by chance, but indeed by hard work, a lot of investment, and indeed by motivating our county healthcare teams with a lot of things, promotions, trainings that were continuously conducted both inside the county and also outside the county. And today, as we celebrate Healthcare Day in my county, I'm indeed happy that we made strides in a very, very important sector for our people, and we're proud that this achievement we made today will indeed be maintained. We hope to improve even further from where we are so that our people can enjoy better health services.
Health is real wealth and not pieces of gold and silver, so they say. And as the county government of Garissa, we believe that the first wealth is health.